Hi, my name is Amy and I'm a respiratory care student with the respiratory care department. And today here I have a patient that has a endotracheal tube already placed in. So before I begin assessing the patient, I always need to check the charts, make sure I need to have everything that I need when I go into the patient's room. Make sure I have all the proper equipment. So like today I'm gonna do an Ambu bag. I'm gonna make sure I'm gonna manually ventilate. So I need to make sure I have the appropriate Ambu bag and the appropriate tubing for the Ambu bag. So when I get into before I get in the patient's room, I always need to wash my hands. And then I always wash my hands before I place any gloving on my hands. And then I'd also put a mask and any gown that I may need when I do this treatment. So when I begin, I need to check everything, make sure everything is properly working. And so I'm going to check the balloon. So the endotracheal tube was already in place. So I need to make sure the tube is, the balloon is inflated still, no leaks or anything. And then right here I have a pharyngeal airway, and that's just to make sure the patient doesn't bite down on the tube, and it also keeps the tongue from falling back and blocking the airway. So when I begin here, I'm going to get the Ambu bag ready. After I have assessed the patient, make sure all their vital signs are ready. Good, and I'll place this here. And I'll turn it up to 15 liters per minute. And then with the Ambu bag, like this one here, I need to make sure this bag stays inflated, that it doesn't deflate, and I always have to have that ready. So when I begin, I'm going to attach this to here, make sure it's properly placed, and I need to make sure I hold it just so that it doesn't move around, and then I'll give 12 to 20 breaths per minute, and depending on if the breath is, if I notice the chest rise is spontaneous, I need to go with the spontaneous breathing. So I'd go every minute here, just to make sure everything is inflates. I don't want to hyperinflate the lungs. So I'm just going to keep going. And once I'm ready, I can remove the Ambu bag. Then I would shut this off to 0. Then I place this in the appropriate place. And then I would attach anything that I needed. So if they needed to continue with having the endotracheal tube in, I would attach the tubing to it to continue to ventilate the patient. So then when I'm ready, then I need to reassess the patient. I need to check their vital signs, make sure their SpO2 is okay, make sure when the endotracheal tube is going into the appropriate place, it's not just going to one of the lungs, and making sure it's going to both. So I'll auscultate, I'll listen to the lungs and make sure everything is going there. So once I am done, I'm gonna put all my PPE in the proper disposal area. So I'd remove my gloves, remove my mask, and if I have a gown on, I'll need to remove that and put it in the proper place and wash my hands. Then I would chart anything that I have done with the patient to make sure, like if I had to reinflate the balloon, I need to make sure I chart that if it needed to be reinflated. And then I would be done.